Good evening, this is Dr. Rod Story. Thank you for visiting my video blog. This is blogging-md.com. Please take a few moments to look around some of the other articles that I've posted that are mostly on fitness and on medical topics of interest. I hope to keep building this blog with more interesting tidbits. This is the fourth in a series on the influenza vaccine and virus. Today I'm going to try and wrap up information about the vaccine, both pros and cons. Let me just remind you that influenza is a significant illness. What I particularly like to impress upon you is if you're going to get the influenza vaccine, that you should do so soon. It takes about 2 weeks to work in your system. There is reportable influenza in the United States, and I suspect with Thanksgiving coming up and family traveling that we're going to have an early season. So I'd encourage you to make that decision soon. Let me give you some information on the vaccine and again why we're going after this. So this is a very difficult illness to address. It changes from year to year. It's very aggressive, very virulent, and very contagious. In some years it mutates and it looks completely new to your immune system. There are very few ways to treat it. Even the antiviral medication that we use is very poor and doesn't do much to limit the illness. About our only tool for addressing it is a vaccine. It is a illness that causes significant deaths from year to year, mostly in vulnerable populations, which includes pregnant women, people with significant immune deficiencies, people greater than age 65 and younger than age 2, and people with respiratory illnesses like asthma. In some years it can be even as high as 30 to 50,000 people that die of influenza illnesses, usually a pneumonia that lands them in the hospital, and that's a significant concern. The vaccine, why do people have such consternation about the vaccine? Well, I think there's quite a few reasons, and I'd like to kind of address them and provide you information so you can make a good judgment for you and your family. I'll try and provide a very balanced plus and minus approach. First off, let me address a relatively new concern, and that's whether the influenza vaccine actually works. There are kind of two issues with that, and actually in some ways it's true that it doesn't work in all circumstances. The first is that the influenza vaccine has to be a match for the circulating virus. Now sometimes the scientists that are doing the surveying work and judging which strains to include in the vaccine don't always create a good match. And that's one of the reasons that it sometimes doesn't work in given years. Thankfully this year it is a good match, and I think actually in coming years it will be increasingly so as the science improves. The second is there's a sense that the vaccine itself just doesn't do enough. And there is some research that actually suggests that this is true, although not in the way you might think. The influenza vaccine, we would hope it would protect those most vulnerable populations that I talked to you about, but interestingly enough, those same situations that cause immune systems to not be able to handle the influenza virus also cause it not to take up the influenza vaccine very well. So in older people, younger infants, pregnant women, the influenza vaccine is actually very poor at protecting. It still is very advisable, but it just doesn't do as good of a job as we wish it would. I think one of the other reasons that people tend to avoid getting the influenza vaccine is they're concerned it's actually going to give them the virus. What you should understand again about the flu vaccine is that you are not receiving the full virus. What you're receiving is instead digested parts of the virus that mostly includes the protein coat. It's what your immune system would usually see. It gives your immune system a chance to prepare ahead of time to build antibodies. It strengthens the immune system, in my understanding, and it does a good job of helping your immune system handle the true influenza virus when it attacks it. So instead, when people get the influenza vaccine, they do experience a variety of symptoms, and I would actually tell you that that is a good thing. When people complain of their shoulder hurting, or when they say, boy, I feel a little feverish, I feel run down, I feel this dry cough, I have a runny nose, that dang virus vaccine gave me the virus. Actually, what you're noticing is your immune system revving up. It's doing what it should. It's recognizing the virus. It's becoming active. Those are side effects of your immune system being active, and it's not the virus itself that you're experiencing. So I would suggest that the more vigorous that response, the better. There is some problem with that, and this is one of the things we just don't talk about very often. It's horrific when it happens, and that's the situation of anaphylaxis. Some people, when they get the influenza vaccine, respond very badly. Their body has such a severe allergy reaction that it can be life-threatening. I'm thankful that this happens very rarely. We think at the most likely it might be 1 or 2 per million shots given. That seems to be mostly related to egg proteins that are used in producing the vaccine. There have been some changes made in the last few years to reduce the amount of those proteins present within the vaccine. I'm thankful that in most cases this does not lead to a severe enough reaction that people are hospitalized or worse. Most of it is recognized early on and treated. I did see an article in the newspaper today where a young man in Utah is suffering after having had a flu vaccine, and perhaps this is the case. Again, I'm thankful that it's extremely rare. Next brings up the controversy of Thermosol. You may not have heard that before, but you may have heard the controversy regarding mercury-containing vaccines. Influenza vaccine is a vaccine that has in the past contained Thermosol, and in some formulations still does. Thermosol is a mercury-containing preservative that, particularly in multi-doses, prevents the growth of infection. I'm not going to address this in full at this point, but to suggest that it is, I think, reasonable to avoid Thermosol, and the way to do it is to only go to places that give single unit doses or one-time use syringes. What that means is that you're not using a vial that contains multiple doses, and because of that it does not require the Thermosol in it. There is an intranasal form that also is Thermosol free, although that has some other issues, and again I'm not going to address that in detail today. So what should you do? What should you and your family do? Well, in our family we've had several memorable influenza seasons that laid us low for 2 to 3 weeks as all of our family members took turns having the flu. We have made a judgment that the risks are minimal and the benefit of skipping the full flu is worthwhile. So we have chosen to line up all of our kids and ourselves and have the flu vaccine. And there is an argument to be made for avoiding all the loss of work and life interruption by choosing to have a bit of the hair of the dog rather than the full dog. I think a bigger argument, however, can be made to do it for your neighbor. And what I mean when I say that is that we're surrounded by vulnerable individuals, pregnant women, young children, older adults, people with lung diseases, people with immune conditions, who are at higher risk if they get the flu, and for whom the vaccines don't work as well. And so they have a double whammy. The way the vaccine works best is if the entire herd, and that's the medical term, meaning as many people as possible in the circle surrounding those patients, are vaccinated, primarily to prevent transmission. So when I take the vaccine, I basically break a link in the chain of transmission that might carry the illness to other people. This is why healthcare institutions and other large institutions push hard for their employees to have the vaccine so that we don't carry the illness or transmit the illness by active symptoms to other people. This is one reason I think I would encourage you to consider strongly doing it. There are many vulnerable individuals that you will contact, many whom you are not even aware that they may have illnesses. And by taking the influenza vaccine and increasing the number of people in the community that are breaking that chain of transmission, it can cause a significant amount of good. Well, I hope that weighs the benefits and the risks for you and provides some information. Again, I would encourage you to seek as many sources so that you can be well informed and you can make a good decision. The flu season is upon us soon, and I would encourage you to make a decision. As always, I welcome any comments, any questions. Please feel free to leave those on the YouTube site, on the Facebook site, or on this blogging site, which is blogging-md.com. Thank you.